This is actually a really nice case that came in because it was most of the teeth. You can see on this is their upper right side, lots of severe recession, even some erosions on these teeth right here. But after we treated it, all of that is gone. So that's really nice to be able to do, able to thicken that gum up, able to actually remove it, because there was even some muscle pulls around here and we were able to reduce those as well. So that's something that's really nice to be able to do. And you can also show the other side too. This is the same thing going on. Lots of recession, lots of notching on these teeth, and we were actually able to cover all of those roots there. So that's really nice, because the pinhole, unlike the previous techniques that we used back in the day, the connective tissue grafting, things like that, you can do a full arch, you can even do a full mouth if you need to, because there's an unlimited amount of collagen that you can use for a case like this. So instead of having to do this in several different segments of doing, grafting when you have to use your natural gums, we're able to do this all in one day. So they can go from that to that in a very short period of time.